Hi guys, hi everybody. Thanks for tuning in today to our kind of first time we've ever really done like a live Q&A with the doctor. So that's me. I'm Dr. Terry Pukanich at Slave Lake Dental. And currently right now, I'm the only one of our doctors doing Botox, although another one of our doctors is getting certified to do Botox. So we get a ton of questions whenever we put something out on Botox on either our website or on Facebook. We get a ton of questions sort of behind the scenes about it. Lots of people sending us little private messages, lots of people texting me directly about Botox. So we thought we'd hop on here. If you have a question, feel free to post it, but you're gonna see me kind of looking down because we had sort of people submit to us already their most kind of common questions people have about Botox. Okay, so I'm gonna get rolling. Make sure, like I said, you just post in the comments, which I'm not sure, Chantal, are they just gonna pop up here, the comments? Okay, so as comments happen, they're just gonna pop up. So here we go. What exactly is Botox? Okay, so I'm gonna show you a vial of Botox. This is what a vial of Botox looks like. And if you can see that little bit of liquid that's in there, this is what we call reconstituted Botox. So Botox comes to us frozen, and it's actually a purified protein, and it looks like a little powder. So what we do when we're ready to use the Botox, because it doesn't, once we start to use it, it doesn't last forever in the vial. There is a shelf life to it. We reconstitute it, meaning we mix it with sterile saline. So we just take this little vial that has powder in it and we load it with sterile saline to make that little liquid mixture. But basically it comes as a purified protein, okay? How we use Botox, there's a super common like misconception, I think, because lots of people wonder kind of like, what does it do? How does it work? And lots of people think that Botox is injected into wrinkles as what you might think of as a filler. So people think we inject it into the wrinkles like this. I'll show you my wrinkle, okay? So right there, people think that what we do is we inject the Botox into this wrinkle and it basically puffs up the wrinkle so that the wrinkle goes away. So it is not used in that way whatsoever. So how Botox actually works is we are going to inject Botox with this teeny tiny, this is a diabetic syringe. So we are going to inject the Botox with this, okay? And what we do is we inject the reconstituted liquefied Botox. We're gonna inject it into the muscles that cause the movement, which ultimately causes the wrinkles. So just for example, here, these number 11 lines that people sort of, a lot of women come in and say, I want to get rid of this. Or interestingly, lots of women come in and say, I want to get rid of like my grumpy face. People think I'm grumpy, but I'm really not a grumpy person. I just maybe frown a lot or something happens and I look grumpy. So here, these wrinkles are actually caused by the contraction of a muscle that runs right here. So what we're gonna do with the Botox is we're gonna inject it into the insertion and the exit of the muscle. So basically the front and the end of the muscle, okay? And what it's gonna do is it's going to relax the muscle so that when I try to contract it, obviously my Botox has worn off right now, I don't have it in, but when we try to contract it like that, it's actually not gonna let us do that. So over time, as we use Botox, these lines and wrinkles, because I'm taking away the ability for you to do that, those lines and wrinkles are gonna actually go away. You can also see right here, right around the eyes, see these starbursts that come around the eyes? When we put it around your eye, we actually get rid of the ability of your muscle to do this. And you can't squeeze that muscle in, and which is what creates the wrinkles. So I hope that kind of clarifies how we use Botox and what Botox actually is. Okay? How long does Botox last? Botox for most people lasts generally somewhere 3 to 4 months. So what we recommend is retreating the areas that you wanted treated every 3 to 4 months, so 3 to 4 times a year, to get the best effect and to minimize the wrinkles over time. So one of the things that Botox can be used for is prevention. So this is where it comes in, where we might talk about, or you might see some articles or some things coming out about doing Botox in your 20s and 30s. So you'll see, you know, sort of, this line in me isn't super deep, but you'll notice now in some people, you'll see that line or the number 11s, even in sort of what we call a resting face, those lines are really deep. If that person would have been treated with Botox in their, say, 20s and 30s before they got all that muscle contraction for a long period of time, you would not see that line as much as you would now. So that's why we talk about Botox for treatment of sort of fine lines and wrinkles, but also prevention of the fine lines and wrinkles when you're young, so that they don't come. Basically, another question, how does it exactly work? So like I said, we're gonna inject it into the muscle and it's gonna relax the muscle. It's gonna make it so that the muscle cannot move, okay? And it's temporary, it wears off. So that's why you have to re-inject it. Oh, I'm getting low battery power. Okay, let me just plug my phone in here. That's why you have to re-inject it every 3 to 4 months, because your body, hi. So I guess that was a bit of a technical glitch on our part. My phone started to die and then I think I accidentally hit end video. So all right, so I'm gonna try to pick up exactly where I left off. Sorry for the technicalities. It's my first time doing a super live video here. Okay, so where were we? We were on how does Botox work? How long does it last? I think I kind of went through all of that stuff. How long does it take to see results? So Botox actually takes 2 full weeks to actually fully kind of sink in and reach its full effect of how it works. So when you come into the office for a treatment of Botox, when you leave the office, nobody will know that you did Botox. Okay, you may be a little bit red, it goes away within 30 minutes, okay? So it's not like you're coming out and everyone's gonna know, because it takes a gradual effect over 2 weeks to start to work, okay? Where can we put Botox? So I'll tell you right now, I am certified to place Botox only from basically kind of what we call upper face, so from bridge of the nose sort of up. The most common places that people are having Botox placed is right here, these number 11s that we talked about before, right there. The forehead lines is another one that a lot of patients, both men and women, like to get treated, is forehead lines. And then another big one is crow's feet. So when you kind of squeeze your eye in, squint like you're looking into the sun, those sort of fine lines around the eyes is where a lot of our patients are deciding to get treatment. So we have a question somebody had posted. Can you make my lips look bigger like Kylie or Kendall Jenner, one of the Jenner kids? No, Botox is not a filler. It's not going to plump anything up. It's not going to plump out the actual line. Like I said, it's going to soften and relax the muscle because we're going to inject it into the muscle. All right, so what will happen at the Botox appointment? So one of the first things that I think kind of sets our office apart a little bit, or a lot of dental offices who do Botox apart, is that our college, the Alberta Dental Association and College, holds our sort of treatment and our patients doing Botox. They hold us at a very, very high level of treatment and documentation. So I think that's what sets us apart a little bit, is that we are actually going to take a whole ton of photos of you, of your face doing this, of your face doing this, so that we can actually get a record of what you looked like before we did the Botox. Then what's going to happen that I think is different also from what happens in a lot of other offices is we're going to mark using a marker. So I'll show you how this marker works, and I'm only one-handed here. So, okay, we're going to mark with this marker. I'm going to mark exactly where I'm going to inject the Botox. So basically it goes like this. So if I'm going to inject right here, and right here, and right here, and right here. These are the very common injection points to get these number 11s, and then we're going to do down here is 1, and then we're going to do up here and up here. Those are basically the big ones to treat number 11. So there's 1, 2, 3, 4, 5, 6, 7 injection sites to treat those number 11 lines. So we're going to mark you as to exactly where we're going to inject the Botox, and we're going to take a picture of the marking. This does for me that when you come in 2 weeks, we see all of our patients who have Botox completed within 2 weeks. And when you come in 2 weeks, and we're going to assess your results, we're going to take more pictures, and we're going to make sure that we injected you in the right spot. So we're going to look at your results. Are they fantastic? If they are, wonderful. We now have our recipe, and we're going to inject you in the same spots every time. If they are maybe not exactly what we were looking for and we need what's called a tweak, we'll add it that day, we'll mark it, and we'll recheck it, and that'll become your new recipe. So I like to often kind of trick my patients when we're doing this, and I put the markings on their face, and then I'll say, so this will come off in about an hour, and they're like, what? No. So it just rubs off. So this is just a cosmetic marker. So it just rubs off your face. So as I inject, I'm going to rub these marks off. Okay. And like I said, you'll have a little bit of redness, but not within 30 minutes, it's all going to be gone. Okay. So that's basically what will happen at a Botox appointment. So I want to just make sure I say hi to everybody who's watching. Thanks for sticking around, even though we had some technical glitches and had to move to a second location so I could charge my phone. Thank you so much for logging in. I really appreciate it. Okay, why does a dental office start offering Botox as a service? I'll tell you, I think probably more than likely it started because we work a lot on in and around people's faces already. We are looking at faces all day long because not only your teeth, sort of your face is a frame for your teeth. So we're already looking at faces. B, we're already doing a ton of photography. So photography for us, when we found out the guidelines for dentists to do it would include a ton of photography, that was a no-brainer for us. Super easy for us to get in and get the before and the after and the during photos to document the whole process. And interestingly, the after photos, I have had probably not a whole ton, but maybe 2 to 3 patients who've come in thinking that I don't think it worked. I don't think the Botox works. I don't think it did anything. So what we do though is we have the before pictures and we have the after pictures. And then as soon as we put the after pictures up on the screen, they're like, wow, that totally did work. So I think that's a super, super important part of what we do. So why dentists? I think, like I said, A, we see your face all the time. B, we're naturals at photography already. And then the last one is that I think that overall dentists actually are very, very skilled injectors. So I would say a typical dentist, within our day of seeing and treating patients, my guess is we're giving an average of, I would say, between 10 to 20 needles. And I don't know, no one likes that word, and neither do I, but we're doing 10 to 20 injections every single day, day in and day out. And we're trying to make them as painless as possible. So I think it's just a natural fit for dentists. I'll tell you why I started doing it is really just to add something new to my day. I found it really fun, very rewarding. You know, looking at teeth all day can sometimes get a little bit monotonous, and me and my team have been having so much fun doing Botox. Hi, we have 3 more people watching, so hi everybody. I'm not technologically savvy. I don't know how to figure out actually who's watching, so thank you for tuning in. Okay, so typical costs. Everyone kind of wants to know costs on Botox. How much is it going to cost? Oh, see, Olivia just said, how much is it going to cost? So basically, I'll tell you, typically this area, to treat just this area, those number 11 stubborn lines that make all of us look grumpy, you are going to need anywhere between 30 to 40 units of Botox. So let me explain to you what a unit is, because people had this question too. So if you look at this diabetic syringe holds 30 units. It's basically the equivalent of 1 cc, if you sort of hear that term, is equivalent to 1 unit of Botox. And the way Botox is charged within every dental office, and I would say every nurse's office and dermatologist and cosmetic surgeon who's doing Botox, we charge per unit because everyone needs it differently. There's not one recipe for every patient. So we're looking at 30 to 40 units to treat the number 11 lines. Per unit, right now, we are charging $10 per unit, okay? To treat the forehead, most times you're looking anywhere between 10 to 18 units. Crow's feet are anywhere between 18 to 30 units. We can also do, one of the things I didn't mention, you can also do brow lifts with Botox. And actually, interestingly, I've treated a couple of ladies with what we call asymmetrical eyebrows. So if you have sort of like, say, one eyebrow that's up, one eyebrow that's down, you can actually try to treat that with Botox by doing sort of unilateral or one-sided brow lifts. Okay, let me see, what else can I tell you? What are these other questions here that we already had? How long, where, lips, how much does it cost? I think I went through all of that. Why? Okay, so our website has a ton of information. So if you want to check out our website, it's www.slavelakedental.ca. Do people say www anymore? I don't even know. Probably just slavelakedental.ca. What's the chances of a reaction to Botox? Actually, Botox is very, very, very safe. We have a comprehensive, what do you call it? A consent form that goes through all of the risks and things around Botox, but generally it's super, super safe. There's only, I can't even remember what's on there now. There's only really, what are the contraindications? Chantel, can you bring me the consent form for Botox? Because I can't quite remember off the top of my head what the contraindications are of it. But generally, it's very, very low risk. Like I said, it's a purified protein that your body just absorbs. Probably the biggest sort of thing that happens afterwards is a headache. You might have some soreness around the sites of injection. You might experience a little bit of swelling. I had one friend experience just a little bit of a bruise around her eye. So other than that, it's really nothing. You cannot sort of lay on your face for at least 4 hours after you've had Botox done. just because it's deposited in very specific spots. We're trying to target, thanks Chantel, we're trying to target the muscle. So it's injected in very specific spots, and we don't want it to diffuse from those spots. So you don't want to rub your face, you don't want to wear a hat, you don't want to have a massage, things like that afterwards. So speaking of massage, this is maybe a good time to mention this special day we're having. You know, we like to have fun here. So we're doing this, my team has come up with this idea that's called Treat Yourself. We did a funny video on it if you didn't see it. So basically, it's one day where we are going to treat all of our ladies who are getting Botox. We're going to treat you to a massage before your Botox and a paraffin wax treatment when you come in to have your Botox done. So it's all about kind of treating yourself and making yourself feel good. I'm just reading the consent form. Gonna wear. Oh, okay. You know what the biggest thing you will read if you Google Botox and complications of Botox or anything like that, the biggest thing that you are going to read about is a drooping eyelid. Okay, so this happens, generally it is not going to happen when we are careful in our marking. So we put all those marks, we inject carefully into the muscle, but it is and we inject using techniques where we find the anatomy of each individual patient and mark it. That is the utmost importance. If we're just injecting willy-nilly, putting it into the forehead, putting it in between, kind of guessing where the muscles are, you can end up with that drooping eyelid. But we have not had any drooping eyelids in the Botox that we have done. It talks about headaches, which I already sort of talked about. Do we do consultations? Yes. So your Botox appointment is actually a consultation appointment. That's exactly what it is. We need to assess you, your skin, your needs, your expectations before we do any treatment. Because Botox is generally actually really quick to administer, like literally to do sort of your whole eyes, forehead, number 11s and foreheads, it's going to take me probably less than 15 minutes to actually do all of the injections. So generally when patients come in for a consultation, we end up doing treatment the same day. The only reason we really wouldn't do treatment the same day is if the patient just wasn't interested after they found more out about it. So yeah, like super, super, super safe. I talked about treat yourself. So I will actually just show you now maybe my own personal before and after that I thought was really good. So when I took the course in February, so the course included one full day of injecting. So we actually injected, I want to say like 6 or 7 people. And then those of us who wanted to try Botox, which I definitely wanted to try, even though I didn't really think I like super needed it, I thought if I'm going to do it and offer it to my patients, I should have it on myself. So basically, I'm just going to answer this quick question from Donine. Can I do Botox around the mouth? No, I personally cannot yet. And that comes from my guidelines from the Alberta Dental Association and college. So what they state, because they want us being responsible practitioners with lots of kind of experience under our belts, I think the easiest and the most simple and the least sort of with complications is injecting upper face only. So that's where we start. I have to submit to the college at least 20 cases, which I have done already. We've done way more than 20 of full photos before and after to the college before I can then move on to take sort of starting into mid-face and then lower face. I've had lots of questions from patients about lower face and most people wanting to sort of treat these sort of wrinkles, but you have to remember Botox is not a filler. So if you have got these sort of lines that are coming and you want to fill in those lines, but Botox doesn't do that sort of stuff. It's just you need filler in there. But it is something that we're definitely working towards to be able to do more lower face and around the mouth. But my own personal story. So I got injected when I was in my course in Vancouver, thinking that I didn't really think it was going to do a whole ton. So this is, I'll just show you here. I hope this comes out okay. Okay, so this is my before. No problem, Dunning. Thanks for tuning in. This is my personal before. Is that like super distorted? Okay, so you can see this is immediately after injection. So this is exactly what I look like. You can see on my one eye, it almost looks like I have a mosquito bite there. That's what the injection sites look like. So this is like literally, I just got done being injected here, and I actually got injected. Like I was like, if I'm gonna do it, well, let's put it everywhere. I think I had, like it was over 100 units, like 106 units. I did like everything. I did the brow lift, my eyes, my lines here, my forehead, everything, okay? So I was sitting at home a couple of weeks after I got my Botox, and I don't know, I was playing on my phone or something, and I looked at myself in sort of like a selfie mode, and I was like, wow, I think there's a real difference there. So I ended up taking this picture. So I hope this is coming across okay. So you can see kind of the smoothing out effect that I got across my forehead and around my eyes was the big one. And I actually really liked it because it's really hard to inject myself. I have tried, and so I need to have somebody else get certified before I can give it to myself again. What age do we recommend starting? You know, it's such a personal thing. I would say I would say the same thing I say when patients ask me, do I need to bleach my teeth? I would never tell anybody they need to bleach their teeth. It is so subjective of a finding in terms of people who, some people have the brightest, whitest teeth and think they need to bleach, and other people have 5 shades darker and don't think they need to bleach. So Botox is kind of the same. I'm happy to do a consultation and chat with people about any sort of areas of concern, but I would never ever tell somebody that they needed to have Botox. It's a very, very personal decision. Hi, Yolande. How long does the treatment last? You're going to look at having Botox last anywhere between 3 to 4 months. So what we try to encourage our patients to do is basically when you first come in and we first do a treatment, that's treatment number 1. Then what we try to do is we pre-schedule you for your next treatment, which is going to be in 3 to 4 months, just like when you pre-schedule to come in for your cleanings. And then we set you up on a sort of a prepay payment plan so that I say we fit it into your beauty budget. So I think most of us are doing, oh God, waxing, eyebrows, eyelashes, nails, hair coloring, pedicures. Botox is working into the same sort of beauty budget and making sure that, you know, it just fits in you and you're not having to. Then when you come in, it's prepaid, if that makes sense. So you're prepaying before you come, and when you come in, you don't have to pay anything. You just work it into your thing. Oh, Andrea, I loved having Botox. I will be getting it again. Well, Andrea, you need to come in on this Treat Yourself Day and get a free massage and a paraffin wax hand treatment, although you probably don't need that. You have a lot of access to that kind of stuff. But thanks, Andrea, for tuning in. Okay, I got some questions here. After Botox wears off, do your wrinkles just come back? Yeah, they totally do. So that's what happened to me, Olivia. My Botox is totally out right now. So my lines are back. My movement is all back. But here's the trick to Botox. If you consistently do Botox on a every 3 to 4 month cycle for a minimum of 2 years, these lines do start to completely soften and go away because your muscles actually start to lose its memory of how to move like that and how to create that sort of expression, So what happens if you can't get back in? Generally, I mean, we're actually, because I said it only takes me, especially when you start to do Botox, and we sort of have done the initial consultation and we know your recipe and we know where we're injecting you, it's generally only going to take about 15 minutes to do your sort of top-up treatment. So we generally can get you in fairly quickly. Okay, so I don't know how to look and see who's talking. So, you know, lots of women come in, so it can be used as a yes, it can be very much used preventatively, ladies. You prevent the wrinkles in your 20s, 30s, and 40s. Wrinkles get deeper and harder to treat as we age, and your Botox results are going to be harder to achieve the deeper the lines are. It just makes for a more difficult case. Women always come in and say, my husband doesn't want me to get Botox. Okay, let me tell you, ladies, if you do not tell your husband, and I'm not telling you to like not keep secrets from your husband, I just want you to know, if you don't tell them you did it, they will never notice. Your face does not get frozen. You have got hundreds of muscles in your face. We are injecting 5 or 6 sometimes. So your face does not look frozen. You still have expression. You can still move your eyes, move your face, and literally he won't even know that you had it done. And neither will your girlfriends, although from what I understand, most people who the first time they have it done, they don't think they're going to tell anybody. And then they end up going and they love it so much that they start to tell everybody about it. And they want everybody to know that they did it and how wonderful it is and how great it made them feel, and all that stuff. I'm surprised. I got like 16 viewers. Hi, everybody. Thanks for tuning in. I really appreciate all of you taking some time to talk about Botox. So I think if there's any men watching, let me tell you, if your woman in your life has mentioned it at all, Botox, get her it as a gift. I think it's a wonderful gift, because a lot of times women don't like to spend money on themselves. You know, we sometimes just sort of, it's always for the kids, or it's always this, or it's always that. Get her the gift of Botox. You want to see the before and after again? Yeah, I'll do it. I'll try to show it to you totally side by side. So there's my before. It is different lighting, so it can be hard to tell, but there's the before and after. All right, so there's before and after. Remember, there's more on slavelakedental.ca, and I actually am gonna call her quits. I'm so happy you came in. I have to go pick up my daughter at Synchronized Swimming. If anybody at Synchronized Swimming is watching this right now, please tell Darby I will be there as soon as I can to pick her up. I hope I covered everything. If not, we're going to post this video, and you can feel free to comment on it anytime you want. I'm happy to see you. I do free consultations in the office. Oh, the last thing, it's super private. Okay, we have 2 rooms in our office that are closed door, and we have 2 consult rooms where we talk about money. So if you want this to be super private, no, people will think you're coming to the dentist for a cleaning. Nobody is going to know that you came in to do Botox, and we try to keep it as discreet as we can. So yeah, that's it. I hope to see you guys in the office. Treat Yourself is October 26th. I think there's only a few spots left. I want to say there's like maybe 3. So they're filling up fast. Call the office 780-849-2233 or message our Facebook page. We love to chat with you. We're really good at getting back to people. And thank you so much for watching. Okay, bye.